Welcome to Nursing 3700, Health and Healing Healthy Communities. My name is Jennifer Abistick and I'll be the lead course instructor. I look forward to working with you all. I've been teaching in this course for a couple of years now, and I hope that we're going to have a great term together and that you will enjoy this course. I'll tell you a little bit about myself. I graduated from Queen's University with a nursing degree in 1995. I worked at Sunnybrook Healthcare Center in the GI and respirology unit, which eventually became acutely ill geriatrics. I then moved out into the community and worked with St. Elizabeth Healthcare as a visiting nurse, and I was in the program where we visited new families and did mom and baby checkups within the first couple of days. I've been a prenatal educator working in the hospital since I graduated, and have worked in a variety of hospitals. I'm also a lactation consultant and have provided breastfeeding support groups within the community. The last number of years, the work that I've been doing has been research related in nursing. I've worked on many research projects. They tend to be in the area of maternal newborn. My research interest in particular is also on including fathers with breastfeeding. So there's a little bit about me, and I look forward to getting to know you throughout the course. The best way to contact me is through the Blackboard email. I will check that regularly. Don't leave me a telephone message, as that's not the best way to contact me. Email is much quicker. Oftentimes I'm working remotely, and so if you need to get me, email is the best way to go. I want to welcome two groups of students. We have students in the bridging program from both the Durham College UOIT program as well as the Georgian College UOIT program, and we are all going to be together in one Blackboard course. So I just want to welcome you all and let you know that there are students from both sites within this course. This course, it has a practicum component as well as a theory component. We will have an orientation for practicum where we will be able to meet in person. You will be working with a preceptor as well as a faculty advisor. And when you have assignments for practicum, they will be submitted to your faculty advisor. I will be the lead instructor for the community theory course. And this will be an online course, and the content for each week will be posted by 10 o'clock on Monday mornings. All the theory assignments will be submitted to me. So the expectations that I have for you are that you will get to know how the course is organized within Blackboard, and you will stay up to date reviewing each week's content. Get familiar with the site. There will be a section where the theory information will be posted, as well as a separate section for practicum. So if you're looking for practicum assignments, look in the practicum folder. If you're looking for theory content, look in the theory folder. My commitment to you is that I will respond to emails within 2 business days, although I have to say I'm usually much quicker than that, but I definitely will commit to that. Meetings, I am happy to meet with you as needed. We can have a telephone meeting or a Skype meeting, and if I do happen to be on campus and you are as well, I'd be happy to meet in person. I will also have your assignments marked and returned to you within 2 weeks, and if that is not going to be the case, I will let you know. If you miss an exam, you will need to provide a UOIT medical statement form, and the exam will be rescheduled. If you require an extension on an assignment, you'll have to request that 48 hours prior to the due date. So please don't leave it to the last minute. It's not fair to myself or to other students. If you think that you're going to need an extension, please be sure to contact me 48 hours prior to the due date. Weekly, there will be content to be covered, and this will include activities and quizzes. As well, you will be put into communities of learning. Within your communities of learning, you will have some questions to discuss. It's really important that you respect one another and show professionalism in all your communications. This includes all online communications and face-to-face communications. We will have a number of Adobe Connect sessions throughout the term. And if you were to miss the Adobe Connect session, if it is taped, you can view it online. If it is not taped, then you'll need to receive the content from a fellow classmate. The aim of this course is to provide a comprehensive critical analysis of community health across various settings. There are a number of topics that we're going to be reviewing. And the idea is that by the end of this course, you will have a very much broader view of health. So the lens through which you are looking at health may have been quite focused and biomedical to this point. And throughout this course, we are going to be expanding your view so that you will be able to identify many other factors which impact the health of individuals, families, communities, and populations. And you will also have an opportunity to really explore and understand the work that community health nurses do to keep communities healthy. Weekly, all the content will be available for you on this interface, and you will see there are a variety of sections. There will be a video, and I will be introducing that week's content within the video, so take a look at the video. Then you can take a look at the agenda, and the agenda will give you information on all the different components that will be covered that week. At the bottom, you can see that there's an activity and a quiz. Every week there will be a quiz, and most weeks there will be a little activity. Take a look to see what the activity is. Both the activity and the quizzes will have testable content. Along the side, you can see the weekly readings, and you will have weekly readings. Many times these will be from the textbook. If the reading is not from the textbook, it will be a PDF, and that will also be available to you within this section. There will be weekly lecture slides. This will review the content related to the readings. And below the slide, you will see speaker's notes. You can take a look and read through the speaker's notes as they may provide some clarification or expand on the information within the slide. Most weeks there will be videos. We are learning about communities and people, and a great way to learn about peoples is to hear their stories. And so throughout the course we will have a variety of videos for you to watch. Some of them will be longer and will have reflection questions. Others will be shorter, just covering some different content that we'll be reviewing that week. You can also see that there is a section for the community of learning. Every week there will be 2 questions, and these are discussion questions that should make you think and reflect on the content. It's a great idea to look at the questions as they're really intended to help you to think about the material. The learning outcomes are on the course outline, so be sure to take a look at them. This is the course textbook. Please ensure you have one. You will definitely be needing it. The readings will come from the textbook most weeks. And this is testable content which will appear on the exams. I want to mention that some of the videos that we will be watching will show some experiences that people have within their lives that are difficult and challenging. If you are very sensitive to watching information that can be a little upsetting, please let me know. I just want to make sure that you know that some of this content might be disturbing for some viewers. And please come and speak with me if you have any concerns. I also want to mention that there are many supports for postgraduate students. If you are finding that you are becoming overwhelmed and that things are really stressful, I just want to be sure that you know that there are supports available to you through your schools, through the community, 24 hours a day, 7 days a week. So be sure to take care of yourself. It's really important as nurses that we take care of ourselves so that we can take care of others. I look really forward to working with you throughout the term.